Hello, everybody. This is Dr. Dan Cartalicchio. I want to welcome you to another segment of Destination Health Podcast, Finding Function in a Dysfunctional World. I am very excited today about having Dr. Amie Hornaman on the program because she is the Thyroid-Fixer, and I take care of a lot of thyroid patients myself. So we're going to have a great conversation. Dr. Amie, welcome to the program. How are you today?
What's up, Dan? How are you doing? I'm doing great. Thanks for having me on.
Yeah, this is going to be a great conversation. I'm looking forward to it. So again, Dr. Amie, she is the Thyroid-Fixer, a woman on a mission to optimize thyroid patients around the world, give them their lives back using her proprietary transformational program, the Fix Method. I got to know what this Fix Method is. Dr. Amie is also founder of the Institute for Thyroid and Hormone Optimization. She's an all-around awesome individual. Looking forward to this. So tell us about your experience. Why did you become into functional medicine? Because none of us were growing up looking into functional medicine. I'm a traditional type of a chiropractor. I have my story. You got a master's in nursing, right? So you're a family, nurse practitioner, right? And so tell me, what got you into this functional medicine?
Yeah, so pain to purpose story, always a pain to purpose story. I was actually we're rewinding quite a bit here, Dan. In my 20s, I was competing in figure competitions and I was doing some fitness modeling. So you always had to diet down. I did not come from a skinny mini family. We have diabetes in my family, obesity, the whole deal. So I had to always bust my butt to get into show shape. But I had done it so many times. I knew how to do it. I knew what to do. I knew what to eat. It was a strict diet, chicken, broccoli, gym twice a day. And this one particular show prep, I started gaining weight. Now, this does not even biologically make sense. I don't believe in calories in, calories out model, but still, like if I am busting my butt, if I'm eating clean, I'm eating protein, my carbs are low, good fats, the whole deal, I shouldn't be gaining weight. So I go to my doctor, like we all do. And I say, this is what's going on. What is going on? Because this isn't right. And they did whatever testing they did back then. I was not in the functional space at the time. And they told me, you are, air quote, normal. Everything is fine. You're good.
I hate that. No. I hate when that happens myself.
Hate the term normal. Hate it. It's so blasé.
Right.
So move on. I move on to doctor number 2, 3, 4, 5, 6, all of them telling me that you're normal and everything is fine. And I still look back and I think, what if I were to stop at doctor number 2? What if I were to stop at doctor number 4, number 5? I would be 200 pounds, bald and tired. I mean, it's ridiculous. So, and this is what I see in my patients all the time, just misdiagnoses, being told they're just getting older, you're normal. So finally, doctor number 7 diagnosed me. Said, you have hypothyroidism, you have a goiter. She puts me on Synthroid. I'm like, cool. Now I have a pill.
You have something that you can sink your teeth into at this point in time, right?
Right. At least there's a label, right? At least I know I'm not going crazy because medical gaslighting is real. So you can feel like you are actually losing your mind as you're being told that you're normal. And you're like, but wait, I'm not. I know something's wrong. So at least I had a diagnosis and I had a pill. And I thought this pill was going to be the miracle. And it wasn't. So I started doing my research, Dr. Google, or maybe it was microfiche back in the day, but at the library.
It was microfiche back in the day, just to let you know.
Exactly. It might have been. I don't know. But on my big gateway computer, I was doing my research like we all do, Dr. Google. And I take this research that I find back to my doctor. I'm like, hey, there's this thyroid hormone called T3 and you have me on T4 and it turns out they work well together. She goes, I don't do that. I said, well, I'm going to find somebody who does. And that's what led me to the functional medicine practitioner that saved my life. He's now my mentor and he's retired now, but he taught me everything I know in addition to saving my life and doing the right tests and getting me on the right supplements and getting me on the right medication. So that totally changed everything around and that changed my career path. So fast forward, here I am now.
Yeah, there's always that story where something happens. It's a personal experience. And for all of our listeners, it's important because we're all going through a struggle. I went through mine. I had the heart attack when I was 37. And so Dr. Amie is the same thing. So she had her symptoms. She went to all the doctors, just like I did, until she found somebody that was able to sit there and to, help out and start the path. Now, listen, being in figure is not easy.
Yeah.
I have a lot of clients in figure. I have a ton of clients in figure.
Yep.
And it is not easy. So if you want to be IFBB, NPC, WNBF, whatever that is, whatever that looks, that's not an easy thing on any male or female. Hormones are all over the place with that.
They take a beating. Yes.
So let me say, I've said this before in the last couple of weeks. A friend of mine is WNBF. He said, send a picture. I sent him a picture. He goes, no, you got to send me a picture in your bathing suit. I said, why? Sent a picture. He goes, I think we can do this. You got a little deltoid here. You got a 1-pack over here. So he wants me to do a show. He wants me to go into the old man division. So I don't know if I'm going to do that. I don't know. We'll see.
It's a great
I'm
challenge.
going to do it. I'm going to do it.
Do it. It's a great challenge. It's something to, as a type A, you always need that carrot. Like, okay, what's next? What's next? What's the next challenge? I mean, I think it's great, but you have to go in knowing, and I know you would, but somebody in their 20s, just like you probably do, Dan, you warn them. You go, okay, just listen though. This is going to be rough on your body. And you might come out the other side a little bit effed up. Like your hormones might be screwed up. Your thyroid might go in the tank. You're probably going to gain an extra 20 pounds after the show's done. So just be ready for that.
100%. How long were you doing figure?
Oh gosh, years. Probably a good 7 years of figure and fitness modeling. And then I switched to powerlifting.
And so really that just played. That's a long time to be in the industry. One of my good friends just passed away, Jenny Lynn. She was one of the most prolific winners during this time. Now you mentioned,
I have a photo with her. I have a picture with her at the Arnold Classic.
Yeah, she was July 18th. I got the phone call in the morning and they said that she had passed away. It was like 7-8 o'clock. She had passed away and it was just a heartbreaking thing, but that's a story for another time. You know what? You mentioned something that I want to go over, and I'm glad that you mentioned this: labs.
Yes.
Because when I'm running labs, right, and when you're running labs, you hear about free this, free that, free tea, whatever. Oh no, we don't do that, right?
Yeah.
We don't do that. I always get it from some of the docs. I'm looking at the doc, his office across the hallway here. He's over here, and he says, "Why are you doing that?" Tell us what the traditional labs are, okay, that they normally get. And what's this free tea something that's going on? I think this is important.
Oh, it's so important. It's so important because I guarantee you, if I could go back and look at what labs they did on me in the very beginning when they told me I was normal, I would bet money it was TSH, which is your standard thyroid test. That's what they learn in med school. If you want to test the thyroid, you test TSH. That's thyroid stimulating hormone. But that's a pituitary hormone. We have to remember that. That's not a thyroid hormone. It's a pituitary hormone. So yeah, okay, if the TSH is screaming at us, then we know, okay, there's a thyroid problem. But it doesn't tell the whole story. So then we go down from there and there's free T4. And that, okay, you'll get that if you're lucky. So chances are I had TSH and free T4 done. And then that was it. We have to go a little bit further. T4 is the inactive thyroid hormone. T3 is active. So if you just remember that, T4 inactive, T3 active. Active meaning that's what gets into your cell. That's what gives you metabolism and grows your hair and gives you a good mood and lets you poop every day. That's T3. That's the power of T3. So we have to test it. It just makes sense. Why wouldn't we test the active thyroid hormone that gets into the cell? That's free T3. Then there's reverse T3, which is your brakes. So you have T3 active, that's your gas. Reverse T3 is the brakes. We want to look at that because I want to know if your brakes are on. I want to know if literally you're pressing the gas and the brake at the same time, the car's not going anywhere.
Right. And when that happens, it just messes up metabolism and physiology, and you're just all over the place at that point.
All over the place. And what I hear a lot from my patients, doctors prior to me when they asked for that test is, well, we only test that in a clinical setting. And I go, well, no kidding. Because in a clinical setting means you're in the ER, you're in the ICU, you had an injury, you're in a car accident, whatever. They test reverse T3. Of course, it's going to be high because God gave us that as a built-in survival mechanism.
Right.
If you're laying in a hospital bed from an accident, you don't need to burn fat. You don't need to feel good. You don't need to grow your hair. You need to survive. So it's going to shut down all metabolic processes that don't have to do with you surviving. Now, take that to day-to-day life. And you're trying to run a business or go to work and take the kids to school and clean the house and make phone calls, but you're in a survival state. Your body thinks that you're lying in a hospital bed. That's not cool. That's not going to make for a good day. It just isn't. So I want to know that. That's an important test to have. And then we've got to check. What's that?
I agree with you. I mean, I think it should be just the standard. I mean, that's what I do. It's a standard blood test that I'm running when I'm doing thyroid, right?
Every test, every single time. Exactly. It should be standard. It should be protocol. It should be as easy as like putting in a CMP CBC. Yep. We do it every single time. So I want to look at that. And I want to look at the antibodies. I want to see if you have Hashimoto's. I want to know that. So we look at the TPO and the TGA antibodies too.
Yeah, that's extremely important. And the thing that gets me, it's in a clinical setting. I don't know. My office is a clinical setting.
That's true. That is true.
Just to let you know, Amie, my office I consider a clinical setting. So for me, you come in, you're in the clinician's office, and so I do that. So let's go back to you for 1 second here. So once you found out and you got the proper supplements and diet and so forth, what did that look for you? What diet did you have? What supplements did you have that helped you out?
So mainly the supplements that support thyroid function. So we love to have magnesium in the mix. I love iodine. I know that's really controversial, but I will go head to head with anybody that says low iodine, because iodine is needed for T4 to T3 conversion. It's needed by every cell in your body. So definitely iodine. There was an adrenal supplement in the mix because competing, I mean, you're going to tank your adrenals because it is a stressor. It's a huge stressor.
I was waiting for you to mention adrenals, but that's okay. Go ahead.
Yeah, huge stressor. And then turns out I also had PCOS, so I was insulin resistant, which I really do see insulin resistance in about 99% of my thyroid patients because the thyroid is the master and it controls everything else below it. Right. Insulin is a hormone. It's going to have an effect on your blood sugar, insulin signaling.
Right.
So I was insulin resistant as well. Back then, berberine, I don't think was a big thing. You know, I was on like a glucose support, but now I love berberine for my insulin resistant patients. Yes.
You know, we were discussing insulin resistance at the university I teach at, and berberine was the first thing that I brought up. And yes, insulin resistance, I find, is a lot when it comes to a thyroid condition myself. So it's kind of like this double-edged sword. You know, it's these complicating factors. And nobody comes in with just simple Hashimoto's, right? There's no such thing as simple Hashimoto's, right? No. There's always going to be something that's going on with that. Now, you mentioned something interesting, that you were gaining weight and yet you were still working out. You're doing cardio once a day. You're hitting the weights once a day. All of that is going on because when you have dysregulation of your thyroid, your weight is all over the place, correct? Tell us
it's
about
literally
that.
out of your control. It is out of your control. It doesn't matter. And I say this all the time because I'll get people going, but I do XYZ diet and I do this and I do that. And I go, yeah, I did too. It doesn't matter. If your thyroid is not optimized, if it is low, if you're going undiagnosed, misdiagnosed, undertreated, then it doesn't matter how perfect your diet is. You are not going to lose and you're probably going to gain. You just are.
It's always like that, right?
Always
like that. And I find, and patients 99.9% of the time, they're like, I thought I would lose weight with the thyroid type of a condition. That's because that's what you hear, right? When you're hypo, because you may lose that weight, but it's not like that all the time. And that's an important point to make. Now, let's talk about toxins,
Yeah.
insecticides, pesticides. I can talk about this for 15 hours straight, and I'm sure you can. Oh boy, because we're living in an ever-present toxic world. And tell me what's going on with these toxins.
It's so crazy. So I see the liver being impacted big time. And we have to remember the liver is an organ that converts T4 to T3. So very important for thyroid.
Mhm.
It also methylates our hormones, and
Mhm.
it processes all the toxins that we're exposed to.
Mhm.
So again, you have to remember the air that you breathe, the water that you drink. I mean, okay, maybe you have a whole house purification system, but I guarantee you 100% of the water that you drink is not purified. You're out and about, you're driving, you're traveling, you're stopping and grabbing a bottle of water with BPAs. Everything, everything that we come in contact with is a toxin. And that doesn't even include the food that you eat, the hormones and antibiotics that are in your meats. It just literally everything that we come in contact with has to be processed through the liver. So the elevated toxin exposure that we're seeing nowadays, especially in the last couple of years, it's putting a beating on people's livers. And I see elevated liver enzymes, obviously hormonal issues because the liver can't do its job. And then we will see weight gain and other conditions like migraines and just depression, anxiety, everything stemming back from that liver not functioning properly and an overexposure and overburden of toxins. And then we can pull in the adrenals too. Those toxins are a stressor. They are a stressor on the body. So number one, with Hashimoto's, we know that that switch turns into the on position with any kind of stressor. Pregnancy is a stressor. So a lot of times ladies will say, you know, it was after my second kid that everything started going downhill. But even just simple toxin exposure, that is enough to be a stressor on the body to flip the autoimmune switch. And then we see the adrenals coming into play and they start getting all wonky, maybe producing too much cortisol, and then they don't produce enough cortisol, and the thyroid needs cortisol and cortisol needs the thyroid T3. So both of those have to work together. Your adrenals and your thyroid work together. We need everything working properly. We need everything working together, like we said earlier, playing in the sandbox nicely, right? We need everything playing in the sandbox.
Well, that was offline. We were talking about playing in the sandbox.
But I'm bringing it back in as an example.
Yeah, there you go. Very important. And you know what? You know, this toxic soup that we're living in, it's just causing so many different problems. How do you approach a patient? All right, when you're looking at it and you're saying, geez, there's a toxic overload here, right? You know, your main detoxifying organ is your liver, and it's just not working. How do you approach somebody to start changing this lifestyle, to start changing their way of thinking, to get out of this crap that they're in, if you will?
Yeah. You know, I mean, starting simple, really. Number one, I mean, use a stainless steel water bottle instead of plastic. Get the glass containers, throw away your Tupperware, change out your body wash, body lotion, and your makeup there's a million different organic brands these days, paraben free, sulfate free, all of that free. It's more readily accessible now than ever before. So there's no excuse. You can't say like, well, I don't have a Whole Foods near me. Well, no, go to your local grocery store and it's going to be there.
You could go right there. It's in the local grocery store. You could buy local groceries right there, fruits and vegetables, you know, that are locally grown. And that's just so much better.
So much better. Yeah. Buy local, go buy half of a cow, invest in a $200 freezer from Lowe's and buy half of a cow. Cause number one, it's going to save you a ton of money in the long run. I mean, you're getting like steaks and burgers for, you know, $5.99 a pound as opposed to $18.99 a pound. So just even purchasing half of a cow, grass-fed meat, buying organic, you know, when you really sit with people and you show them there's not that much of a difference price-wise, like really, it's not that
pennies on the dollar. It's pennies on the dollar, Amie.
Pennies on the dollar.
Yeah.
And all those little mini changes add up. And I always tell people, listen, it's not like you're going to do this and lose 10 pounds in a month, But 6 months from now, you're going to look back at everything that you cut out and you're going to go, whoa, okay. Now I see the toxic exposure that was in my life, because now that I cut it out, I can look back and say like, holy cow, I had no idea. And all those little changes make a big difference. Now, I also like doing a liver. I hate using the term cleanse because everybody thinks that you're going to poop for days. Just a liver support, a liver detox, supporting those detox
I like that,
pathways.
liver support, because that's what I'm going to start using. Can I use that in the office, or do you have a trademark with that?
No, go ahead. You can use it. Yeah. Just
because I got my liver support right here, because I'm going through because when they hear detox and cleanse, they think of
an
enema, they think of juice, they think of all of it just conjures up ridiculousness.
And they think they're going to feel like garbage, and you're not. You shouldn't. This shouldn't be like this detox Herx reaction where you feel horrible for days on end.
Right. 100%. And this is very important, to take an inventory of your life. And that's why I had asked this, because I'm getting a slew of patients in lately where I'm asking them to take an inventory of what they have around themselves. And some people do, and some patients don't, and it just seems like they're not doing that. And they're resistant to this change, although they come to see us as that last resort. So be careful. Listen, Dr. Amie, how many doctors did you go to before you went to the other guy? 6 or 7, right?
6, and then the 7th one diagnosed me. Yeah.
Yeah, that's just way too long. And that's just too much to go through, And when you're younger, you don't want to go through this. When you're older, you don't want to go through it anyway either, right? You want to be healthy and so forth and so on. So let's talk about health.
Yeah.
People are like, it's normal. What's normal? You and I talk about optimal health, perfect health, or as much as we possibly can. What do you have with that? What are your thoughts on that?
So I have a place that I tell people about. It's called Optimization Land. It's kind of like Disneyland, but with less rides and less mouses and less Mickeys. But no, Optimization Land is a place where you, and I'm speaking from experience because I've been there and now I'm here, where you just feel good. Like your brain's alive and on fire, and you can get tasks done, and you can multitask and get everything done by the end of the day and not be dead on the couch. Right. It's where I can have a glass of wine. I can have a gluten-free bun with my burger. I can increase my carbs. I can go on vacation and I'm not 10 pounds heavier. I'm not gaining 5 pounds by looking sideways at a brownie like I was before. It's just it's a feeling of this is how life should be lived. And you might still have moments of depression based on circumstances, or you might get a little bit of an insomnia based on a stressful situation, but it's not a chronic thing. It's not day in, day out. You're struggling to get out of bed. You're depressed every day. You're anxious for no reason. You can't get to sleep no matter what. You can't lose weight no matter what. And those signs and symptoms, and I know you'll agree with me, anytime a body shows a symptom, that is a signal that something is off. We might not know what until we dig a little bit more, but that is your body saying, hey, hi, something's going on and it's not good. So you might want to get this checked out.
Yeah, we need to take it to the next level. You've mentioned anxiety and depression multiple times. What is that with the thyroid? What is that with the detox? Because what's going on in the world today, there's a lot of anxiety, there's a lot of depression. We're all, a lot of people have been experiencing this, for a couple of years, there's a lot of stresses. So talk about a little bit about anxiety and depression with thyroid.
So we mentioned T3. I said earlier, T4 is inactive, T3 is active. So if you think every single cell in your body has a receptor site on it for T3, and your brain has the most receptor sites on it for T3. So if we're not getting, if we are hypothyroid, think low and slow, like you feel like, low. If we're not getting enough of that active thyroid hormone into our brain, mood changes are going to occur. And usually, again, it is that low depression mood, but it can be accompanied by just that anxiousness, just, you're snippy, you're snappy, you can't handle stress. And then we can bring the toxins into that too, because when you are in toxic overload, you do not handle stress like you used to.
Right. This is important because so many people are coming in with this anxiety, a lot of depression. They're coming in and they don't even know why. It's just that they're just so fatigued over what's going on. They're fatigued with themselves because, did you find in your office that individuals, CDC said, during the last 2 years, people have gained 20, 25 pounds. I'm saying 50 to 60 pounds. I'm seeing people come in.
Yeah.
Do you find that? I mean, they're eating processed foods. They're eating, white bread and things of that nature, because all of this attacks, all of this can cause problems with your hormones and with your thyroid, especially these processed foods.
Definitely. So it's kind of like it's a vicious cycle that's occurred. So we had the lockdowns, and we had the people not knowing what the heck is going on, losing jobs. So there's the depression and the stress and increased alcohol intake. We saw that like crazy in 2020, increased processed foods. Yes. So those toxins, alcohol is a toxin too, all the garbage and processed foods, those toxins start to affect the thyroid, just like a stressor, any kind of stressor. It doesn't have to be, when we say stressor, we're not talking about, a death, a divorce, anything. We're talking about just those internal stressors. So those toxins are a stressor on the body that flips on the hypothyroid switch. Well, then you have people that can't even get in to see their doctor because their doctor's office isn't seeing you. So they're walking around going, so, okay, something's wrong. I'm putting on all this weight. They blame it on the lockdowns. They blame it on, eating poorly, but it could be a combination. So now we have, okay, your thyroid might have taken a tank from all the stress and your bad eating and your alcohol use. So now we have to check it, because that's a double whammy. Now you have all this garbage in your body, you have the toxins in your body. Oh, and your thyroid isn't working, and you're probably insulin resistant too, based on all the garbage that you just ate. So you have a variety of things going on that's causing the weight gain. And it's just, it's just a vicious cycle going on. And if people continue to be misdiagnosed, not diagnosed, like I was, then they're going to blame it on something else, or worst case, they're going to blame themselves. Sure, you might have made some poor choices, but don't continue to blame yourself and beat yourself up, because if it is your thyroid, it's not your fault.
Yeah, 100%. We're almost done here, Dr. Amie, and I feel like we're just warming up. So we're going to have to have you come back. We're going to have you come back. Let me ask you, do you want to go on stage with me?
Oh no, my competition days are over. I'm nice and steady now. I don't want to do the up and down anymore.
You don't want to do that?
No.
I'm gonna try it a different way. I'm gonna see if I can get on there without that. So I don't know, you can be I'll send you pictures. It's like, oh no, just don't do it yet. You're just not ready.
I'll be honest with you.
You can sit there and say, well, your waist is a little bit. You got a 3-pack going. You need another 3 that are in there.
Yeah.
Okay. So I don't know. I'm going to see if I can get you to go on stage. We can do the
Masters division.
The Masters. Oh, that just bothers me. Anyway. All right. We're almost done here. Tell me, if you were to leave 3 pearls, clinical pearls for the audience today, what would they be?
Ooh, good one. Okay. Number 1, first and foremost, is listen to your body. Like we said earlier, the symptoms that you have, whether you want to call them signs, symptoms, pain in the butt, things going on with your body, whatever you want to term it, listen to it, because that is your body giving you feedback. And it gives me feedback. If you're my patient, I sit and listen to you, and I pair those symptoms up with your labs to paint that whole picture to figure out what's going on. Listen to your body. Number 2, be your own patient advocate and get all the labs done. My rule of thumb is, if a doctor says no to labs, it's time to get a new doctor. That is a hard and fast rule, period. Because if your doctor won't do complete labs that you're asking for, that you are flat out coming to him with a list, him or her, with a list, and they say no, do you really think they're going to treat you properly?
Yeah.
No.
I think that's important, number 2, because I don't know, I'm running the same labs that you're running, and I get a lot of flack sometimes, because I may be co-managing something with another doctor. And,
Mhm.
why,
Yeah.
why? Well, my academy says I can't, we don't have to do this anymore. But 5 years ago, they said they did. And they're doing it for a reason, and it's important. And here's the reason why it's important. So to be your own patient advocate is really extremely important. And if they're not getting the results, and if you don't feel comfortable, there's nothing wrong with getting a second opinion with us, right?
Right. Exactly.
All right,
Exactly.
that's number two. One more.
That's number two. Number three is have hope, because I know
Yeah.
a lot. If any of your listeners are in that low and they've
Right.
been dealing with this for a while, maybe they gave up on doctor number 3, 4, and 5, who said that they were normal. And then they're sitting there going, oh man, it must be my fault. I must be going crazy. They're
Mhm,
saying that I'm normal, but I don't feel normal.
mhm.
You need to have hope to keep going. Because if you stop here,
Mhm.
that's exactly where you're going to stay stuck. And that's exactly how you're going to feel the rest of your life, but you don't have to. And
That's important. You don't have to. And having that hope, giving us a call is extremely important, because we can at least give you a different type of a look. And that can mean all the difference in the world, because Dr. Amie, we do that all day, every day, right?
exactly.
100%.
Exactly. I mean, we both hear, it's funny that you said that earlier. I always hear, I want you to know you're my last hope. I go, I'll take that label all day. I will take on that
I
label. I
take
will
that.
take that. I will take
Right.
that burden as well, because I got
Right.
you.
If, we all have a reason to be here. So this is, if we're the last hope docs, we're the last hope docs, and
Yep.
I'm good with that.
Yep.
It's all good. Now,
It's
how
part of
can
club.
individuals that are listening contact you?
They can go to my website at dramihornaman.com. So that's DR. And then on there, you can book a call. So you can book a free discovery call if you're
Awesome.
interested in learning more about working together. And we'll, go through your health and we'll figure out if you're a good fit, and we'll take it from there.
Awesome. And we're going to have that in the show notes.
Yep.
And we're going to have because you have your own podcast, your
Podcast.
Instagram page, so that people can contact you. We'll have that in the show notes.
Yep.
And for everybody listening, I personally recommend Dr. Amie. Give her a call. This is her wheelhouse, thyroid. Give her a call. Do that discovery call. It's for free. Thank you very much for doing that, because that's a valuable service, especially when you're looking for that last hope. But
Yep.
have hope, have high hope. There was a song
Yep.
about Frank Sinatra, High Hope, but that's a story for a different time. However, have that high hope so that you can, all right, there's hope out there. You can get better. Dr.
Yep.
Amie, we're just warming up. We're going to have you back on. This is great
Love it.
conversation. Want to thank you for being here today. Want to thank everybody for listening in. Live your best life. Dr. Amie, thank you very much.
Thanks, Dan.
Take care.